a virus that spreads through rat urine and droppings, often hidden in the very places we feel safest. It carries a death rate of nearly 40%. There is no vaccine and no specific cure. In many parts of the world right now, it is silently spreading. If you live in rural areas, enjoy camping, or are simply cleaning out an old building, this information could be the difference between life and death. This is the silent killer that science is still racing to understand. Welcome to Dr Ayurvedi. We share simple, effective Ayurvedic remedies daily for a healthier, happier life. We focus on well-researched, natural practices to fight misinformation. Now, let's explore today's urgent guide. In the next 11 minutes, you will discover the mysterious history of Hantavirus, what it really is in 2026, the early symptoms most people tragically ignore, and the exact biological pathways of its spread. I will walk you through step-by-step precautions to protect your family. Our guide is built on the latest clinical data from the WHO and CDC. The tragedy of Hantavirus is its simplicity. Every year, people lose their lives after doing something as routine as cleaning a basement or opening a summer cabin. The terrifying part? The early signs are indistinguishable from the common flu, fever, body aches and headaches. By the time the true cause is realized, the lungs are often filling with fluid, making breathing nearly impossible. Unlike other modern threats, there is no magic pill or vaccine here. Once severe, doctors can only support your body while it fights for its life. It is a visceral struggle for every breath. To understand the danger, we must look back to 1993, to the Four Corners region of the United States. A healthy young marathon runner suddenly collapsed and died from respiratory failure. Within days, his fiancée also died. This mysterious outbreak baffled doctors until investigators tracked it back to an explosion in the deer mouse population due to heavy rains. This was the moment the world truly realized that a hidden threat had been living among us for centuries. It changed medical history and showed us how environmental shifts can trigger deadly viral spikes. Biologically, hantaviruses belong to the Bunyaviridae family and are spread primarily by rodents. In the Americas, we primarily deal with Hantavirus pulmonary syndrome or HPS, which is exceptionally lethal. In Europe and Asia, the virus often manifests as hemorrhagic fever with renal syndrome, which attacks the kidneys. Understanding which variant is local to you is the first step in assessment, but the core danger remains the same across all borders. It is a versatile and resilient pathogen. The incubation period is a silent window of 1 to 8 weeks. During this time, you feel nothing. Then the early symptoms hit. High fever, severe muscle aches, particularly in the large muscle groups like the thighs and back, along with fatigue and dizziness. Many patients also report abdominal pain, vomiting and diarrhea, which often leads to a misdiagnosis of a simple stomach flu. This is the critical window where awareness saves lives. If you have been near rodents, do not ignore these signs. Around 4 to 10 days after the initial symptoms, the dangerous phase begins. This is when the virus attacks the lining of the blood vessels in the lungs, causing them to leak fluid directly into the air sacs. This is Hantavirus pulmonary syndrome. It feels like drowning from the inside out. Shortness of breath becomes acute, blood pressure drops, and organs begin to fail. With a 40% fatality rate, the margin for error is non-existent. This is a medical emergency of the highest order. Let's debunk some common myths that lead to dangerous behavior. Myth number 1. Only dirty houses have rats. Fact. Rodents seek shelter and food everywhere, especially in pristine rural areas during cold months. Myth number 2. Hantavirus is just like the flu. Fact. While it starts that way, the 40% mortality rate makes it far more dangerous than any seasonal influenza. Myth number 3. You can catch it from your neighbor. Fact. Except for very rare strains in South America, there is no person-to-person transmission. Your environment is the only enemy here. How does it actually enter your body? The most common route is aerosolization. When rodent urine, droppings or saliva are disturbed, like when you sweep a floor, microscopic virus particles are kicked into the air. You breathe them in and the infection begins. It can also happen through direct contact with contaminated surfaces, followed by touching your nose or mouth, or very rarely through a rodent bite. In almost all cases, it does not spread between humans, making your environment the primary risk factor. Awareness of your surroundings is your first line of defense. Preparation is your best defense. Before you enter an old shed, attic or crawl space, look for signs of infestation. Droppings, shredded insulation, or that distinct musky odor. If you find them, do not reach for a vacuum or a broom. This is the most common and deadly mistake. Instead, you must wear a fit-tested N95 mask, rubber or vinyl gloves, and eye protection. You are walking into a biohazard zone. Treat it with that level of respect. Professional grade protection is not optional in these environments. The safe cleaning protocol is specific. First, ventilate the area for at least 30 to 60 minutes before you even step inside. Then, instead of sweeping, thoroughly soak the affected area with a disinfectant. A mixture of 1 part bleach to 9 parts water is standard. Let it sit for a full 5 to 10 minutes. This wet cleaning method ensures that no particles can become airborne. Wipe the area with paper towels, double bag everything for disposal, and then decontaminate your gloves before removing them. Thoroughness is your protection. While often associated with the Americas, Hantavirus is a global concern. In Asia and Europe, the hemorrhagic fever with renal syndrome or HFRS affects tens of thousands of people annually. In India, research continues into various strains like the Thottapalayam virus. Whether you are in the forests of Scandinavia, the fields of China, or the rural heartlands of India, the presence of rodents means the presence of risk. Different continents, different names, but the same clinical urgency. No region is truly exempt. Climate change and localized weather patterns play a massive role in outbreaks. A mild winter followed by a rainy spring can lead to a mast year, an explosion of seeds and berries that causes rodent populations to skyrocket. More rodents mean more interaction with human dwellings. Understanding the ecological rhythm of your region is part of your safety toolkit. When nature surges, the virus often follows. Monitoring local wildlife alerts is a proactive way to gauge your risk level throughout the year. Long-term prevention means making your home a fortress. Seal every crack larger than a quarter inch with steel wool or caulk. Rodents can squeeze through incredibly small gaps. Store all human and pet food in airtight, chew-proof containers. If you are camping, never sleep on the bare ground and keep your food stored inside a vehicle or a bear-proof container far from your tent. Use wet mopping for all dusty areas in rural homes and always disinfect traps with your bleach solution. Small habits eliminate large risks. It is about consistent vigilance. Protecting your space is a daily commitment. It is important to distinguish Hantavirus from other respiratory threats like COVID-19 or the common flu. While COVID is airborne and highly contagious between people, Hantavirus is primarily an environmental threat. You won't catch it from a cough in a supermarket, but the mortality rate is dozens of times higher than the flu. It is statistically less common but significantly more lethal once contracted. Understanding this difference helps prioritize your hygiene efforts where they matter most. This is not about panic, but about accurate risk assessment. Who is most at risk? Farmers, hikers, and construction workers are on the front lines, but anyone in a rural or suburban area with rodent activity is vulnerable. Because there is no cure, treatment is entirely supportive. If you develop a fever or respiratory issues after being in a high-risk area, seek medical help immediately, and this is vital. Tell your doctor about the rodent exposure. Early ICU care and oxygen therapy are the only tools we have to tip the odds in your favor. Do not wait for symptoms to worsen. Time is the most critical factor in survival. To summarize, hantavirus is a silent, lethal threat carried by rodents. The primary danger is breathing in contaminated dust. Never dry sweep or vacuum rodent waste. Always wet clean with bleach. If you feel flu-like symptoms after exposure, seek emergency care immediately. Prevention is the only certain protection we have. Stay alert, especially in rural and forest areas. Awareness is the first step to safety. We have the power to protect ourselves through knowledge and correct action. We are our own best defense. If this deep dive has helped you, please like and subscribe to Dr. Ayurvedi for more life-saving insights. Comment, stay alert below. Remember, learn before you medicate. And as always, heal inward, shine outward. I am Dr. Ayurvedi and your health is our priority. Thank you for watching and stay safe.